Alright, so we are going to start Chapter 11, Treatments of the Psychological Disorders we were just talking about. So our learning outcomes today are explaining the psychodynamic approach to therapy. Remember Dr. Freud, the behavioral approach to therapy, using Skinner and Ivan Pavlov, and the cognitive approach to therapy. Now, psychotherapy is talk therapy. So what we have here is you go in, talk to a therapist, there's back and forth, and over time, by working through the therapist, you develop strategies and a new perspective and a new way of looking at your issues that you're having to deal with. So that's one way to deal with with treatment, anyways, is to talk therapy. Biomedical therapy mainly relies on medication or shock therapy. And shock therapy is still used to this day, and it is highly effective. It works really well. Shock therapy does. And then there's transmagnetic stimulation that focuses. It's a phone. All right, that focuses on a specific area of the brain. All right. All right. So, like I was telling you earlier, the psychodynamic therapy seeks to bring conflicts and unacceptable impulses to the light of day. So anything you got going on in the unconscious, you want to bring out to the conscious so that you are able to deal with the problems more effectively. Okay, that's Dr. Freud, psychoanalytic approach. Same thing. What happened to you when you were a kid that screwed you up? Let's go in there and let's figure this out. Sorry to say. And he did this through what's called free association. Free association is when the patient or the client just says anything that comes out there in the mind. For Dr. Freud, he liked to have him lay on the couch and not face him, kind of like looking up in the ceiling or against the wall. And he thought this would make them more relaxed because maybe they didn't, see the therapist. Have to think about what therapists' facial expressions are, whether or not they're judging and stuff like that. He thought another way is dream interpretations. He was the first guy to write a book about dreams and what they could possibly mean. And then transference is when you transfer your feelings onto someone else. Okay, so if you hate your mom, or if you have issues with your mom, you may transfer your feelings about your mom to someone else. Whoever that might be. Psychodynamic approach can be very long and very expensive. It's not cheap, and it's still used to this day. It's effective, but like I said, it could take many different sessions, and it could be highly expensive, and who knows if your insurance will cover it. Now, remember that, if you can afford it, why not do it? Why not just have therapy? Just have someone to talk to that doesn't judge you. If you can afford it, that is. Okay, the behavioral approach to therapy uses, operant and classical conditioning again. Reinforcements and punishments and connecting between two stimuli. All right. Aversive conditioning is, like treating someone with alcohol, or who is an alcoholic, and they can't control their behaviors because there is a reward mechanism, right? A reinforcement for drinking makes you feel good, makes all those bangs go away. Well, if you give them a pill that makes them get sick, well, every time they drink alcohol, you get rid of that reinforcement, and it actually becomes a punishment to drink alcohol. So Again, adversarial conditioning, something that's pleasant, make it unpleasant somehow. And then you can make the connection through classical conditioning. Systematic decentation is a way to help with phobias, specific phobias. Like, for example, let's say you have a phobia of snakes, and you can't even be around a snake. You can't even look at a snake on TV. Well, how can we get better and not be so afraid of snakes? Well, one thing that you could possibly do is systematic decentation. Basically, it's a step-by-step process to get you to your main goal of holding a snake. So maybe you just look at a picture of a snake, and then the person gets really anxious and starts crying, but they can't maintain that level of anxiety for very long, because your body would want to come back down. And once you calm back down, go to the next step. Pick up the picture of the snake. You might get nervous again. You start crying, and all of a sudden, after a while, it goes back down. Okay. Then look at a model of a snake. Same thing. Goes up, and then comes back down. Pick up the model. You keep on doing that. Then you have a snake in an aquarium. Well, take a step, and you start crying. But eventually, you get to the point to where you're right in front of the snake, and you get anxious, and then you calm down, and then eventually you'll pick up the snake. Okay? It's an exposure therapy. Whatever you're afraid of, expose yourself to it. If you're afraid of spiders, expose yourself to spiders. If you're afraid of, mice, expose yourself to mice. Again, operant conditioning. Ivan Pavlov, you can use the token system. Every time a person does a behavior, give them a token that means something to that person. So maybe every time they get a token, they win an ice cream cone, or something that means something to that person. Whatever that could be. Again, you can use a fixed ratio schedule. You could fix continuous schedule. That eventually, the person will change their behavior. Dialectical behavior therapy means to accept yourself for whoever you are, even the parts you don't like. Okay? I have my hair is gray. I got a kind of a weak chin. I got hair growing on my ears now. And I got some hair growing on my nose. I accept that. It is who I am, and I accept the bad with the good. And so, for you to be able to be happy, you have to completely accept who you are. Still have goals to strive for, still motivate yourself, do things that you enjoy, but also accept yourself for who you are. Behavioral therapy actually does work very well, especially with anxiety disorders, phobias, compulsions, social skills. Again, operant and classical conditioning, adversive conditioning, and all those good things. So, again, very good things to use. Cognitive approach to psychology is changing the way people think. In fact, a lot of people in psychology believe depression is really just a way of thinking. Really, what is depression? What is it? It's a way of thinking. And so they would surmise that the best way to get rid of depression is not through biological means or not by behavioral means, is by changing the way you think, seeing how you can see the world differently than what you did before. If you could change the way a person thinks, well, then they would eventually come out of depression and not think that way. Rational emotive behavior therapy. Be more rational, be more realistic about your life, about your dysfunctions and your behavior. understand that some of your behavior is irrational. If it is irrational, is there anything you can do about it? Or maybe sometimes your ideas are irrational. Sometimes the way you see the world is irrational. Well, if you can categorize it as irrational, well, then you can change those things to become more rational. And again, like I was saying earlier, cognitive therapy is the ability to change one's thoughts. Again, some people believe that depression, anxiety, phobias are a way of thinking. If you change the way you think, well, then you shouldn't experience those things again. So cognitive therapy is successful. So a lot of places, or a lot of therapists, use what's more eclectic approach, cognitive behavioral therapy, biopsychosocial therapy. Those tend to be the most helpful and most beneficial for both the patients and the therapist, who uses a more eclectic, all-around, encompassing approach to treating the person's illness.